Okay, hi everyone, good day. This is Daniel Tugahan, and for today's video, I am going to demonstrate the basic first aid skills, and this will help you in any situation. So what is first aid? First aid refers to the emergency or immediate care you should provide when a person is injured or ill until full medical treatment is available. Okay, so you are in a hurry cutting some papers for the schoolworks and you accidentally included your finger. What you need to do is to wash your hands or clean using free alcohol wipes. It helps avoid infection. Second is apply an antibiotic. Apply a thin layer of an antibiotic ointment to keep the surface moist and help prevent scarring. Certain ingredients in some ointment can cause a mild rash in some people. If a rash appears, stop using the ointment. Third is cover the wound. Apply a bandage rolled gauze or gauze held in place with paper tape. Covering wounds, keep it clean. If the injury is just a minor scrape or scratch, just leave it uncovered. Next is blister. Blisters are one of the most common hiking injuries and are caused by friction between your skin and ill-fitting socks and or footwear. To relieve blister-related pain, drain the fluid while leaving the overlying skin intact. What to do if you have blister? First, wash your hands and the blister, and then clean a sharp needle with rubbing alcohol. Then, use the needle to prick the blister in several spots near the edge. Let the fluid drain, but leave the overlying skin in place. And then, apply an ointment to the blister and cover it with a non-stick gauze bandage. If a rash appears, stop using ointment. Okay, next is burn. Burn is one of the most common injury in cooking. Chefs are usually suffer this injury at work. If you are not careful, it's easy to get burned. But anyways, here are some ways to aid burns. Burns has three categories. The first, second, and third degree burns. First degree burns affect only the epidermis or outer layer skin. The burn site is red, painful, dry, and with no blisters. Second degree burns involve the epidermis and part of the dermis layer of skin. The burn site appears red, blistered, and may be swollen and painful. Third is the third degree burns. Third degree burns destroy the epidermis and dermis. Third degree burns may also damage the underlying bones, muscles, and tendons. The burn site appears white or charred. There is no sensation in the area since the nerve endings are destroyed. So here are the treatment of the three categories of burn. First is the first degree burn. You need to cool the burn, immediately immerse the burn in cool tap water or apply cold wet compresses. Do this for about 10 minutes or until the pain subsides. Do not apply ice. Next is the second degree burn. The same process with the first degree burn. You also need to apply a cold and wet rag and then protect all burns. Cover with sterile or non-adhesive bandage or clean cloth. And lastly, the third degree burn. Call 911 immediately if there is someone suffered from third degree burn. Next is insect bites. Most insect bites are mild and can be treated at home. They might cause itching, swelling, and stinging that go away in a day or two. There are also insect bites that can cause difficulties of breathing. If that happens, call 911 immediately. Insect bites are small injuries, but it can lead to serious injuries or death. Tick bites. If you are bitten by tick, here's what you need to do. First, remove the tick using puller. If the tick is attached to the person's skin, remove it immediately. Second, cleanse and protect the area. Third, put antibiotic to the area bitten after removing it. And if you feel any symptoms, call the doctor. Next is the trigger bites. Trigger bites are uncomfortable, itchy, annoying, and can make it difficult to sleep. In most cases, trigger bites don't cause any harm to your health. To treat the bites, scrub the chigger bites well with soap and water to remove any chiggers that are still attached to the skin. Second, put lotion or anti-itch cream. It can help with the itching. Next is the spider bites. Most spider bites can cause mild and treatable symptoms. The bites from black widow and brown recluse spiders require medical care. If the victim suffers from swollen, redness, pain, nausea, vomiting, or other symptoms, get to medical attention immediately. Next is the snake bites. Snake bites is an injury that happens when you're bitten by snake. The snake bite is dangerous if snake is venomous. Gently wash the bitten area with soap and water. Then, elevating the head and shoulder, bandage the bitten part firmly but not too tightly to stop circulation. And then splint the bandage bitten part to rest it. And call the 911 or seek medical attention to give antivenin as soon as possible. Next is nosebleeds. Nosebleeds can be frightened but they aren't usually a sign or anything serious and can be often be treated at home. During a nosebleed, blood flows from one or both nostrils. It can be heavy or light and lasts from a few seconds to 15 minutes or more. What to do to stop a nosebleed? First, firmly pinch the soft part of your nose, just above your nostrils for at least 10 to 15 minutes. And then, place an ice pack or bag of frozen vegetables covered by a towel on the bridge of your nose. Next is choking. Choking happens when someone's airway suddenly gets blocked, either fully or partly, so they can't breathe. So here's what to do if there is someone who's choking. First is stand behind them and slightly to one side. Support their chest with one hand. Lean them forward so the object blocking their airway will come out of their mouth rather than moving farther down. And then give up to 5 sharp blows between their shoulder blades with the heel of your hand. The heel is between the palm of your hand and your wrist. And then third is check if the blockage has cleared. And if not, give up to 5 abdominal thrusts. Call 911 if the person's airway is still blocked. Continue the cycles of 5 back blows and 5 abdominal thrusts until help arrives. Next is shock. Shock is a critical condition brought on by the sudden drop in the blood flow through the body. Shock may result from trauma, heat stroke, blood loss, an allergic reaction, severe infection, poisoning, severe burns, or other causes. Common signs and symptoms of shock include low blood pressure, altered mental state including reduced alertness and awareness, confusion and sleepiness, cold moist skin, hands and feet may be blue or pale, weak or rapid pulse, rapid breathing and hyperventilation, decreased urine output. To treat the person having a shock injury, lie the person down with raised legs, call 911, and then loosen tight clothing. And lastly, keep them calm and warm. That's all for today. I hope you learned from it. Thank you. Bye-bye.